Hi, everyone. Welcome back. My name is Amanda Gold, and today we're going to be talking about heart health. During the past few months, our lives have completely changed. People's habits have changed when it comes to eating, exercising, sleeping, and more. The impact these changes have had in our lives have had a major impact on heart health as well. Heart disease is the #1 killer of women in America, and Intermountain Healthcare and the American Heart Association Utah Division are working together to improve heart health. Today, we have two experts from Intermountain Healthcare to talk to us about life's simple seven simple ways that you can improve your heart health. Today, we're joined by Dr. Sheralee Petersen, a physician assistant at the Intermountain Heart Institute, and Dr. Nishant Sekaran, a non-invasive cardiologist at the Intermountain Heart Institute. Thank you both so much for joining us. We really appreciate it. My first question to the pair of you guys is about blood pressure. How does blood pressure play into heart health, and what can people do to best manage their own blood pressure?
Thanks, Amanda. Great question. So over the past several decades, we have learned a lot about blood pressure. And specifically, we've learned a lot about blood pressure and how it's protective for stroke prevention, heart failure prevention, and heart attack prevention. Over the years, a lot of the goals have changed, but the fact remains that blood pressure lowering at all levels is extremely protective for stroke, heart failure, and heart attack. And people are wondering, well, how do I get my blood pressure lower? And there's a lot of things that are non-medical that can be done. So sodium moderation, regular physical activity, limiting alcohol intake, and in general, losing some weight. And all of those interventions are the equivalent of about a blood pressure medicine. There are some people for which there are underlying conditions that need to be diagnosed, but they can be diagnosed and they can be treated.
Quick question about that as well. If I don't know I have high blood pressure, is there a way for me to find out or even start this process of learning that I should be looking out for those specific things when it comes to blood pressure? And I'll have you answer that as well.
Yeah, great question. So awareness is super important, and I can't overemphasize that. Over time, there have been home blood pressure cuffs that people can purchase at the pharmacy, and they're well calibrated. They give excellent information. And in general, home blood pressure readings, when done in the right ways, so taking a couple of measurements when you're at rest, sometimes twice a day, I'll tell people, and just taking an average. And depending on who the person is and what their risk factors are, there are different levels. But in general, we like to target a blood pressure of less than 130/80 for most patients. If there's any other question, we have 24-hour blood pressure monitors that can help answer that as well.
And I know when you go to get your annual, that's usually something that they take as your blood pressure. So it's important to look at those numbers and have a discussion with your physician about what that means. The next question for you guys is about cholesterol. Cholesterol contributes to plaque, which can clog arteries and cause heart disease and stroke. How can people control their cholesterol, and what specific numbers should they be looking for?
Thanks, Amanda. So in brief, cholesterol is this fat, kind of waxy-like substance. It comes from two primary sources. It comes from animal foods that we eat, as well as our liver. And I think it's really important to acknowledge that cholesterol is not inherently harmful. Our body actually needs it to build cells. It's an important part of our body, but too much of it can indeed pose a problem. So the way that people can control their cholesterol is, first of all, knowing where their cholesterol levels are at. Interestingly, it's recommended that all adults over the age of 20 have their cholesterol checked every 4 to 6 years. And so if you are listening to this and you're over the age of 20 and you've not had your cholesterol checked in the last 4 to 6 years, that's the first step. As people turn 40 years old, we start to use a little more detail in our evaluation of overall risk. And we use an equation that determines a 10-year cardiovascular risk that then allows us to make some guideline recommendations for prevention. So cholesterol really comes down to as you take cholesterol and you break it up, there's good cholesterol, there's bad cholesterol, there are triglycerides. Our good cholesterol that most people have heard of is called your HDL, or again, the good. And some people say H is happy, so H is good. And then your LDL is the bad cholesterol, and that you want to be lower. The number goal targets are customized to a person, but in general, it's felt that HDL should be greater than 60 because it is protective. And then our LDL, or the bad, is ideally less than 100. And then in some people, it's actually recommended to be lower than that. And then our triglycerides ideally are less than 150. So when it comes down to it, what can we do in terms of our diet and lifestyle to modify these numbers? A heart healthy diet is super important. I oftentimes talk to my patients. It's not even just good fat, bad fat in your diet. It's even just simple carbohydrates that our liver turns into triglycerides. It's a really big problem in our current culture and our American diet. So avoiding simple sugars is really important. And then we just can't overemphasize the value of physical activity related to cholesterol and maintaining a healthy body weight, and quitting smoking if you smoke is also very important.
I'm sure too that if you have a history of heart disease in your family too, you're looking out for those symptoms or those different aspects that you're talking about. Maybe you're looking at your diet a little bit more carefully, or your cholesterol a little bit more carefully. That's super important when you go to get your annual and you're filling out that information about what your family history is, to really look at what pertains to you and how you can kind of adjust that as well.
Definitely. We definitely take family history into account as we're calculating your overall risk and recommendations for risk reduction.
Another thing we hear a lot about too is blood sugar, and how high levels of blood sugar can cause a lot of other problems, including negatively impacting your heart health. What specific role does blood sugar play in heart health, and how can people best manage that as well?
A great question, Amanda. So we all love sugar in some way, shape, or form. And our bodies, what they do is that they take some of the processed sugars that we have and a lot of the simple starches, and it converts it into a digestible form of sugar that ends up entering the bloodstream. Our bodies in turn produce insulin, and insulin is really important for the cells of our body to use that sugar appropriately. Unfortunately, either because people can't produce enough insulin or they just are resistant to it, they end up getting a condition called diabetes. Over time, when you have very, very high blood sugar levels, it can cause some damage to the inner linings of the blood cells. So it can lead to inflammation. It could lead to some of the plaque buildup that Sheralee talked about. And over time, it can be quite harmful, not only to the arteries of the heart, but also the brain and the kidneys and other organs in our body.
And with COVID-19 too, our diets, our lifestyles, they've completely changed, like I mentioned at the very beginning. And a lot of people are now staying home. They're not going to the gym. They're not getting as much exercise as they maybe normally did, but staying active is a super important part about having a healthy heart. Why is the activity level so important, and how can people still be active, especially during COVID-19?
Such a great point, Amanda. It has caused a drastic shift in all of our lifestyles, and it's important to acknowledge that and recalibrate and acknowledge what's going to work best for us in our current situation. If you look at the recommendations in terms of research-based recommendations for what amount and what types of exercise have clinically proven benefit, the American Heart Association says that we all need 150 minutes of aerobic exercise in a week. So if you break that out into your week, it's 30 minutes, 5 days a week. We can also do 75 minutes of more vigorous aerobic activity on a weekly basis and get a similar benefit. So for people who enjoy a higher intensity exercise, you do get more bang for your buck, if you will, for the time spent. And there's also a recommendation that we do at least 2 days a week of muscle strengthening exercise. So that additional component on top just has even further benefit. It's been understandably profoundly more difficult for the reasons that you mentioned during COVID-19 for us to all get our exercise in. And so as I've thought about this and as I've talked to patients about what this looks like, the question that we really need to ask ourselves is, in what creative ways are we going to remain active during this time? And that answer is really just different for everybody. The bottom line is we still know that benefits are outstanding, and it's certainly worth the commitment. And particularly right now, we all deserve taking that time for that self-care. I think that's a really important point to make as we speak about physical activity during COVID-19. In general, one fact that I always find so fascinating is that people that have heart disease risk factors who participate in regular physical activity, they actually have a lower death rate compared to, say, their neighbor who has no risk factors, but they're not exercising. So exercising really does a lot to reduce our cardiovascular risk, even with known risk factors. That's important. We know it reduces the risk of heart attack. And as previously mentioned, it helps to lower our blood pressure and our cholesterol. It helps to improve our blood sugar and of course our body weight. And again, I'll highlight the mental health benefits of exercise here. It reduces stress. It's known to reduce stress. It improves sleep quality and it improves our memory. And I haven't met very many people that say they don't need improvement in those areas, particularly right now. Maybe some of you are out there, but overall, the benefits of exercise are outstanding. The funny thing is I think the majority of us know that and recognize that. And the question is, well, how do we get there? And it really comes down to just creating habit. And habit is hard, and it's changing our ways of doing things. And so as I counsel patients who are looking to start an exercise regimen, we talk about setting a goal that's achievable, that's small to begin with. And for those that aren't even exercising at all to begin with, we set a simple walking goal, say like 30 minutes, 5 days a week is their long-term target, and they get out 1 or 2 days a week to start. So make it customized to you so that it's actually achievable and enjoyable for you.
Those are some really good tips. And there's also a lot of free resources out there too when it comes to being creative with your exercise right now. I know that I can't go to the gym anymore, so I'm finding other ways to be active. A lot of people also don't have access to weights necessarily, so you're being creative and using maybe a jug of water or filling up water bottles that they have laying around the house, using books as weights. It's all, like you said, about being creative during this time and kind of figuring out what works best for you. There's lots of tools out there, and there's also resistance bands, which I think people don't look at a lot, that can kind of not substitute, but replace for now weights. And those could be used in your house, which is really great. So like you said, being creative and figuring out how to keep that 30 minutes a day exercise is super important. And I know it's hard, especially now, you don't want to do a lot, but it is very important. So thank you for talking about that. I appreciate it. Another thing too is your diet. Not only is your lifestyle important, your exercise important, but your diet is also important. And with us all working from home right now, the most traveling we're doing is moving from our couch to our kitchen or our bed to our couch. We're not really getting the opportunity to go explore new foods or try different things. And we're usually cooking from home right now. Why is a healthy diet so important for a healthy heart, and what should people be looking for when they go to create a meal?
Yeah, it's such a timely topic, isn't it? So we have such a complex relationship with food. It's not only a source of nutrition, but especially in these times, it can be a source of solace, a way of coping. And one of the positives are that we get to enjoy more of the meals with our family members at home. And for some, that can be a very positive experience. And maybe for some, they'd rather not do it. But overall, when we think about food, it really can impact not only our sense of how we feel about ourselves, our nutrition, but it also, it's about values and choices. And it's some of the things that we like the most about foods we love. It's either going to be sweet, it's going to be salty, or it's going to be a little bit fatty. And there's no free lunch. There's always a trade-off in the choices that we make. But in the cardiovascular medicine community, we really like the Mediterranean style of eating. One, there's really good data that supports its cardiovascular benefits in terms of longevity and in terms of reducing heart attack and stroke. But to break it down, what it actually means is minimize your processed food intake. Try to consume as much as you can whole grains, fresh vegetables or fruits, nuts and legumes, and plant-based and lean-based proteins. We try to limit some of the gamey meats or some of the red meats. In terms of the fat selection, we generally like to stay away from saturated fats, and what that means, so some of the larder varieties, some of the tropical oils, using more olive oil, more nuts. But overall, I mean, I think there's lots of choices to make, and sometimes we're just forced to make practical choices. Just try to make them healthy ones.
You didn't mention this part specifically, but I know too, when you're working at home, a lot of what you're doing, if you're bored or need something to fill your space, is reaching for a snack too. And it feels like we're constantly eating if you have access to your kitchen, if you're working in your kitchen. Is there any specific snacks that are really good to fill you up and that are good for your health as well?
something that's really, I mean, just there's a bunch of vegetables lying around the house, and just cut it up, get some fun shapes. You can even experiment with some sauces that you can dip it in. And you'd be surprised on how delicious they actually are. Nuts are a wonderful way to snack, and preferably the unsalted variety. But there's also things that you can find in cans if you wash out all the additional sodium. In my house, we really like chickpeas. And we just put chickpeas in olive oil, and they're kind of like potato chips. And you can use either herbs from your garden or just simple condiments.
I love that chickpea idea. I'll have to try that. I've just eaten them straight out of the can before after I've cleaned them off, but I've never tried to crisp them up. So that's a good idea. Another really important aspect of a healthy heart is the habits that you have. Cigarette smokers have a much higher risk for developing cardiovascular diseases. What impact does smoking have on your heart, and what are some ways that people can start kicking that habit as well?
It's such an important topic, Amanda, particularly given the fact that smoking is the most preventable cause of death in the United States, and that's quite profound. We know that smoking is linked to about 1/3 of all deaths from heart disease and 90% of lung cancers. And interestingly, after a patient quits smoking, 1 year after, their risk of heart disease actually goes down by half, and that's quite dramatic after just 1 year. The other important topic in this space is the active vaping crisis that we're currently experiencing in the country. And I think that's also important to acknowledge. Kicking the habit is so tough and a lot harder said than done, but definitely can be done. As I counsel patients who are seeking assistance in smoking cessation, I talk to them about the importance of being kind and patient with themselves and celebrating small successes. They're already feeling negative about the habit if they're seeking assistance in quitting. And also talk with them about what their support network looks like. Who can they rely on to be a support through the process? What motivates people to quit and the approach that they take is so varied, and it really needs to be customized to the individual. It's proven, and not surprisingly so, that people are more likely to quit if the plan to quit is customized to their lifestyle. So that's an important factor to take into account. And the great news is there are incredible resources out there. On the American Heart Association's website, there is a wealth of information about quitting smoking. And beyond that, again, even more information. When you drill it down to what makes people the most successful that we have seen over years of smoking cessation, there are really 5 common themes that are associated with the success of cessation. Number 1 is to set a quit date, ideally within 7 days when you decide to quit. And number 2 is to choose your method. Are you just going to do it cold turkey, or are you going to try a taper program? Number 3 is to talk to your medical provider, decide if you'll need medicines or other resources to help quitting. If you feel like you're not able to do that on your own and some medical assistance would be helpful, this is a conversation that any medical provider would be thrilled to have with you and discuss options and to support you in the process. The 4th is to plan for your quit day and then afterwards. So what happens when you're tempted to smoke? What happens when you used to smoke during this or that event, or the response to this or that was always a cigarette? So how do you proactively plan for those times to ensure that the answer is not a cigarette? And then 5th is quit for good on your quit day. Commit to that. And I come back to be kind and patient with yourself and celebrate those small successes. The negativity is not going to help with quitting, with the quit. And so remembering to, again, kind of coming back to self-care, to support yourself, be kind to yourself, just like you would to a friend who's trying to quit, and acknowledge that there is a wealth of information and resources out there for you.
Those are some really great tips, and I think it's important that people have the ability to access these tips too, and we'll put up some resources for people to look at afterwards. My last question for you guys, if people would like access to your wealth of knowledge or have an appointment with you, is it possible to set up appointments either with the Heart Institute or a doctor to kind of learn more about how they can help live a healthier lifestyle within their own heart? And that's for both of you. I'll let you answer first.
Sure. Most definitely. We're happy to talk with anybody who has any particular interest or specific questions, and to help guide you in the right path. A number that you can call is 801-507-3500. That's to the local clinic that Dr. Sekaran and I work in, would be a good starting point. You can also find information on our Intermountain website related to the cardiovascular services that we provide. And specifically tonight, if you just Google the American Heart Association Simple 7, the information there is very valuable. It's succinct, it's to the point, and really gives a phenomenal foundation to kind of kickstart a person's commitment to their health.
And Dr. Sekaran, what about you? I know that Dr. Petersen just gave that phone number, but is there any last words you'd like to say on how people can reach out to you or how they can start living this healthier lifestyle?
Yeah, absolutely. So that number is a good one to make an appointment, but venues like this, where we're having a public conversation about healthy living, cardiovascular prevention. So we can do more Facebook Live events. That seems like kind of fun. But, you know, I think some people have businesses or they have community centers that they really want to hear more. And we certainly would be willing to set some venues up to educate people more broadly in the community outside of an individual appointment.
Well, thank you both. And that blog article that you were referring to about the Life Simple 7, we actually just posted in the comments. So if you guys are interested in viewing that, you can view that there. We're really proud to be a partner with the American Heart Association Utah Division, and we really do encourage everyone to live life according to these 7 simple rules. We want to also remind people to seek immediate care for heart attacks or stroke by calling 911. Just because you feel like you're okay doesn't mean you are, and you should go get that care that you deserve. You can learn a lot more about heart health as well at intermountainhealthcare.org and just use our search bar to find out about our cardiovascular services that we provide. And remember, if you have mild to moderate symptoms and would like to get screened for COVID-19, you can do so by calling our hotline at 844-442-5224. We also have our emotional health relief hotline still available 7 days a week from 10 a.m. to 10 p.m. That phone number is 833-442-2211. Thank you both so much for joining us today, and we will see everyone next time.